Residents have a unique opportunity to learn about how to teach in clinical settings from an education specialist who shadows them for a few hours or a full shift in the hospital or in clinic in any department at Main or South Campus. The education specialist shadows you as you teach at the bedside or other clinical settings, provides feedback on teaching, and offers tips for how to give feedback to medical students. The education specialist has experience and training in learning theory and instructional development. She utilizes shadowing with both residents and faculty as a way to provide one-on-one coaching for teaching in clinical settings. The education specialist has experience observing bedside teaching in OBGYN, general and trauma surgery, emergency medicine, psychiatry, pediatrics, family and community medicine, internal medicine, and neurology. So what do we look for when we're shadowing residents as educators? First, we look at how you include medical students in patient encounters. For example, do you encourage the student to actively engage in all or some part of a clinical exam, such as an ultrasound exam? We also look for how you prepare students to engage with patients. Do you just send them off to the room to see the patient and say, "I'll check back with you later"? Or do you give them something specific to observe for or to discover? We look to see how you build rapport with students. Rapport builds confidence in your teaching and demonstrates your interest in the student's learning experience. So you can ask about their passions, their goals for clerkship or medical school, what specialty they'd like to practice, and what they want to work on. We look for what kind of learning climate you create or help to create. Do you observe the learner, encourage their active participation in clinical encounters, assess their ability to engage in certain tasks and suggest tasks suitable for their level of training, and provide an appropriate challenge to push them to the next level? Food breaks model wellness, so don't hesitate to take a food break with the student. This is also an excellent time to just chat and get to know them a little better. So for everything we look for in good teaching, like creating a great learning environment for the student, building rapport, providing support, preparing them to engage in clinical encounters, we also provide support to help you do those things even better. We also share good teaching practices that we observe with other residents and faculty throughout the college and encourage you to do the same. Whether you're a resident, faculty, or residency program director, please contact me if you'd like to schedule a shadow observation, instructional coaching, or a workshop on clinical teaching.